Kaitlyn Schaner's persuasive speech. Imagine waking up to a phone call from the Mandan police at 2 o'clock in the morning. The officer states the teens' names and asks the parents to report to the hospital to see their teenager. John and Carrie, as parents, get to the hospital to see their daughter Katie lying in a hospital bed. Only then do they find out that she was sent there because she was struck by a car with an underage drunk driver. Underage drinking is not safe and/or acceptable. Drinking at a young age has many long and short-term side effects. Most communities offer teens ways to prevent underage drinking and ways for treatment if they have already went down the wrong path. Alcohol can lead to lifelong physical and mental effects. Some of these effects are not very easy to overcome, and some, in fact, may even be impossible to overcome. After drinking for a long period of time, it starts to become an addiction. Addiction to alcohol is known as alcoholism, and with this addiction, persons start to rely on alcohol. It then becomes very hard to refuse it. Some people do not think teen alcoholism is a big issue. These people may say things like, "That's what kids do," or "All kids try it." However, teen drinking is not okay, and it impacts many teens' lives today. Studies show that addiction varies in young men versus young women. For example, when boys start to become addicted, they lose their ability to focus on additional tasks. On the other hand, when girls begin to be addicted to alcohol, they have trouble with copying drawings and doing puzzles. One thing, though, is the same for teenage boys and girls. According to Teen Health and Alcohol, they both start having trouble in school or with their parents and administrators. Kids are not fully developed yet in their teen years. At the age of 18 or 19, the brain is not yet fully developed. Drinking alcohol can cause permanent brain damage, and we are learning that heavy exposure to alcohol might adversely affect a part of the brain called the hippocampus, which is very critical to our ability to learn new information and to deeply encode it so that we can remember that information accurately later on, said Dr. Tappert. Some other alcohol-related consequences are an enlarged heart, muscular damage, stomach ulcers, and even cancer. But the worst consequence of alcohol is death. In underage youth, alcohol is responsible for more than 4,300 annual deaths. In 2010, there was approximately 189,000 emergency room visits by persons under the age of 21 for injuries and other conditions linked to alcohol. Before the long-term effects kick in, it is necessary to recall the effects that lead up to this point. Often teens do not like the taste of alcohol, so they start drinking it fast just so they can skip straight to the fun. This type of drinking is known as binge drinking, which is 4 or 5 drinks at one time or people drinking up to twice a weekend. In 2012, the National Survey of Drug Use and Health reported that 24% of youth aged 12 to 20 years drink alcohol, and 15% reported binge drinking. Some people may think that binge drinking is not bad because if not done often, it may be thought that a few drinks are okay. The other problem is 1 in 6 teens binge drinks, yet only 1 in 100 parents believe his or her teen binge drinks. Parents often have too much trust in what their children are doing. Even though parents might not believe it happens, once a teen takes that first sip, the body starts taking action, and there is no turning back. An altered mental state leads to very poor decisions. The nervous system is the first and most effective system when the alcohol enters the body. Coordination and concentration starts to become impaired, and it is very hard to remember things. It is like the brain begins to lose control of the whole body. After the nervous system is affected, the digestive system begins to work overtime. It starts producing more and more stomach acid, causing urination and puking. As the effects start to get worse, it starts to impact breathing or the respiratory system. Once breathing is impaired, it can lead to a hospital visit or even death. This type of drinking is not okay. We need to start taking action and making sure kids understand the consequences of underage drinking, especially at excessive amounts. Society needs to start preventing more and more kids from beginning this bad habit at such a young age. And for those already addicted, treatment needs to be offered. Prevention starts with the people that are closest to the underage drinkers. Family needs to start making expectations and consequences clear in their household. A teen's drinking pattern depends strongly on the drinking patterns of the teen's parents and peers. A teen should start surrounding him or herself with individuals with a positive attitude and a healthy mind. If a teen is in a family where the parents drink more, it is more likely for the kids to also start drinking at a young age. Law enforcement also needs to become stricter about the problem of underage drinking. People may think that the law should stay out of their lives and let them be free, but law officials are just trying to keep us safe. Underage drinking is not safe. Enforcement of the drinking age is the first step the law needs to take. If the community started reducing the amount of time alcohol can be sold in stores and reducing how many places teens can get alcohol, teens will have less access to the problem. The problem will then, at least slightly, begin to reduce. The law could start getting the community involved by encouraging an end to underage drinking. Some communities sponsor alcohol-free parties so young people can see that they can have fun and enjoy socializing without using alcohol. As an individual, to prevent drinking, a teen needs to be confident and have a high self-esteem. Teens can get involved in positive activities such as Trust in Teens. Being involved in mentoring makes a teen less likely to drink because they start to realize that they have someone looking up to them and someone who someday hopes to be just like them. If the teen is already struggling, there is plenty of ways to find help. The teen needs to be willing to help him or herself and have a positive attitude about it. They can start going to alcohol education programs and start surrounding themselves with positive peers and role models. The law may send the teens to community service, and taking advantage of this and using it in a positive way can help the teen. Underage drinking should not be tolerated. It could affect a person for life. A couple of hours of fun could affect a person's whole life. Prevention and treatment needs to be taken seriously in our community. At the same time Katie's parents walked into the hospital, so did the other driver's parents, with not even a clue that their teen has ever tried alcohol. Imagine that.